I remember one story in particular about a couple with Down syndrome who the woman ended up pregnant and they couldn't work out how because he had definitely put that condom on the banana. Just Ask is a project that works specifically with learning disability. It works with the wide range of disabilities from severe to moderate. And the age range, the youngest I've worked with is 11 and the oldest is 83. So there's quite a span there. We deliver our sexual health and sexual awareness programs within Just Ask, the same as we would within our young men's projects, within our young women's projects. The difference is it has to be delivered differently. Two of the more interesting individuals that I work with, two gentlemen, one called Mark, one called Nigel. Mark is a character. I think Mark would be happy enough for someone to describe him as an angry young man. Nigel is a man in his mid-40s who's a gay man. Incredible character, incredible story. Nigel has came a long way.
Jeg var med min far, jeg ikke den at der skulle en kursutur at me. Connect with a couple of people on the side of a beer or something.
Mark had been mollycoddled most of his life and resented that but went along with it. I think he got a bit of a shock with the Just Ask project when, you know, he wasn't allowed to hide behind his disability. And I think that opened Mark. The first thing Mark ever said to me when I met him was he's not going to talk about these feelings things. He hasn't stopped talking about them since.
Sadly, he hasn't stopped giving with somebody. I've been fired by marriage, but nobody thinks about marriage. A couple of kids on the go.
We're getting a partner, that's another thing, Michael, definitely. Looking for one for years. Still haven't got one yet, do you know what I mean?
We've worked through developing Nigel's ability and confidence to accept where he's at and who he is. Not that he's ever had a problem doing that, but I think the confidence in stepping out with it has come through working with Just Ask and through the FPA.
It's about loving, caring, I was going to say sex, I suppose it's, yep, that as well. But it's getting them at the right place too. You know what I mean? You've just got to be a wee bit careful. You just have to be. I think if Mark and Nigel were given, which they have been through Just Ask, the information they need and the support they need, they're as capable as anybody else of making informed choices. I think the difficulty people have is just leaving them alone to do it. One of the areas that we work with within Just Ask is working with parents. Parents have a lot of fears and concerns and anxieties, and when you add learning disability and sexual health, sexuality into that, those fears go through the roof. I tell parents that I'm going to encourage their sons and daughters to take risks. That normally sends shockwaves through the room, but it's safer risks, informed risks. And that way what you're doing is giving someone the opportunity to make mistakes. Young people with learning disability or people with learning disabilities have a right to make mistakes.
Michael has moderate learning difficulties. He is dyspraxic and he's dyslexic. There's lots of issues that he's not aware of. When I heard about the Just Ask programme, I knew that it was something that was going to be for him.
We give them information, factual, correct information. We talk about penises, testicles, vulvas, vaginas. We don't use silly words. If I ever meet a man again over 25 with a tinky winky, I'll cry. It's a penis. And what you do is you empower that person. The next time he goes to the doctor, he'll be able to talk about his penis, not his tinky winky.
He said, I would feel so much more confident going to the doctor and saying, you know, I have a problem. And testicles and all this, you know. And in fact, actually, there was one of the parents in the group, and I have to share this, she said that her son asked her, Mum, do you check your breasts? Because he said it's very important, he says, and that I check my testicles. And, you know, she thought this was wonderful.
what our work is all about is developing an individual. And we look at how we actually develop that individual to gain self-esteem and confidence about themselves. There's no point in giving someone information about sexual health if they haven't got the confidence to actually access that information or to use that information.
What makes our list up here different? What else? White